Good afternoon, everyone. My name is Rama, and I'll be your host for today. I want to say thank you very much for joining us today. I think it's going to be a great afternoon, and I know that you will have a lot of other things that you wanted to do today, and you've really taken time out of your schedule to come and join us because this is a very interesting subject. Today, we'll be talking about the aging spine. How to cope and function. Okay, you got that recording in progress announcement. This is a joint effort between MNCC, which stands for Malaysia Network of Caring Communities, and ReGen, which is a rehabilitation hospital. Our speaker for today, I will introduce her later. Her name is Dr. Kavitha. If we just move on to the next slide, I just want to tell you that everything that we do here is actually available on the Facebook page. And what you see right now in front of you on the screen is what has been done before and what's going to follow. So on the Facebook page, you will find videos, and also on the MNCC website, of previous sessions in this series. So the first one was rehabilitation for the bedridden elderly. Second was mobility issues in the elderly. The third was prevention of fall, keeping a safe environment. And the last time we met was assistive devices and technology to keep the elderly and physically able. And today we'll be talking about the aging spine, how to cope and function, as I already said. And there's one more coming up, which I'll talk about towards the end of the hour. If we move to the next slide. Today, the program is pretty much our standard program. You'll be done hearing me in just a couple of minutes. And then we will have the really interesting and very well illustrated talk, which will go on for 40 minutes. And then we'll have about 15 minutes for Q&A, but we are tolerant on that, so we can go a little longer if there's a lot of questions. Moving on. Now, there's some very important things that we have to be aware of. Please keep your microphone muted at all times, because we don't want to hear the mewing of your cat, and we don't want to hear any arguments that spoil their domestic bliss. Keep your video camera off to ensure that you have a more stable internet connection. You already know that this session is being recorded, and so the fact that you're still with us means that you've consented to this recording. So if you don't give us consent, then you should log off right now. Please don't. But if you feel that you must, you must. You can type your questions in the chat box on Zoom, which you can see circled in the middle there. Just click on that and you can type your questions there. Or you can type it, if you're watching on Facebook, you can type it there in the comment section. And this is not really recommended, but if you really want to ask a question orally, and I'm very strict, you'll only have 30 seconds, then you could raise your hand. But you have to really, I recommend that you write down your question before you ask it. Okay, so that we don't end up listening to long speeches and because everyone has a busy schedule. One very important disclaimer here. We're really trying to raise public awareness and promote healthy living. But whatever information is provided today is not a replacement for a doctor's consultation, okay? So if you encounter any personal health problems, please don't disclose it here. Your confidentiality must be protected. So go and consult your personal doctor, all right? So don't tell us any details, because it's going to be on record and played over and over again. Our speaker for today, okay, this is the most exciting part for me. This is the part I really enjoy talking about. I've had a short chat with this young lady. Guys, she's already married. She's a very charming person. She loves working with people. She's a consultant rehabilitation. I had to practice saying that many times to get that right. Rehabilitation medicine physician at the ReGen Rehab Hospital. She's had over 20 years of professional and educational experiences. She worked in teaching, she worked in government and also private hospitals, because right now she's in a private hospital. But a lovely person, a really nice person to listen to, I think. She's very interested in helping people. She was telling me a lovely story of one of the people that she helped, a paraplegic who went on to win a silver medal in the Olympics. So a person who gets a lot of satisfaction out of what she does, helping people. So I have very, very great pleasure in passing this next 40 minutes over to Dr. Kavitha Ratnalingam. Over to you, Doc.
Okay, hi everyone. Let me just screen share and okay.
There we go. Good.
Great. Okay, thank you, Mr. Rama, for the kind introduction, and thank you, Malaysia Network of Caring Communities, for organizing today's session. Well, good afternoon, ladies and gentlemen. I'm so glad to have you with us today, and I will be talking a little bit about the aging spine and how we can cope and function better. I don't know about you, but my spine is definitely aging. Mr. Rama told a bit of a white lie there about calling me young lady. Well, yes, let's get into this together, and we'll take any questions at the end, yeah? Okay, so we've got to start off with some anatomy of the spine. This will be year one medical knowledge, because I think it's important to sort of that you understand what's in there, because when you have back pain, it can be from one of multiple structures. And even though, yes, we can't always decide which structure it is just by taking a history from you and a clinical examination. Sometimes MRIs are needed, but when we get an idea of which structure it is, then we have a better idea of what plan of management you would have, as well as what your outcomes are going to be like. We'll also talk a little bit about the function of the spine, the aging process on the spine, and basically at the end of it, how to cope. Okay, so the spine. So it's basically it's a flexible structure, and this is the spine if you are looking at it from the back. Whereas this is a spine if you're looking at it from a side view. Okay, so the spine is a flexible multi-segmented column. So it consists of many bones, yeah, attached together. And it's divided into 5 sections. You've got the cervical section, which is basically the bones that support the neck. You have the thoracic section, which is basically the bones of the spine at the chest area. You have the lumbar section, which is the bones of the spine around the abdomen. And then you have got the sacrum, and at the little end, the coccyx, which is the tailbone, which sort of form the pelvic area. So a normal spine, if you see it from the side, has a bit of an S-like curve. If you look at the cervical part, which is your neck, your spine curves in a little bit. Over the thoracic part, it curves out a little bit. And at the lumbar, which is, that small of your back, it curves in a little bit again. And so this S curve is actually really important because it actually helps distribute your body's weight. So the curve actually helps distribution of body weight, and it helps the spine handle stress better. So if you're walking, you're jumping, you're moving around, because of this nice curve, it helps the spine. It's not one part that's taking all of the weight and the stress, but it helps to distribute it better. So, when friends share the load, it's not, the work isn't so hard, right? But the other thing to remember is that the spine is one long segment, and the bones are all connected to each other. So even if you have one part that has a problem, or one part that has an injury, other parts are going to get affected. You know, it's one section or one segment will affect the other segments as well. Yeah. And generally, a lot of people complain of lower back pain. That would be from this region, because it is.
Sorry, can I just interrupt for one moment? Could everyone please put your mics on mute? We can hear someone's noises. So Vivo 1901, could you mute your mic? And there are some others also. Thank you. Please continue.
So it's usually the lower segment, which is the lumbar area, that takes most of the body's weight. But even then, even if an upper segment is affected, all the segments will be affected to some degree.
Ayo.
Okay, so now we have got the individual bones that we are looking at. Okay, so this is one vertebrae. The vertebrae consists of, and the vertebrae are actually the building blocks of the spine. Yeah, you just build upon each other. And it has a big part, which is the vertebral body. And the vertebral body takes a lot of the weight as well. Yeah, and this is attached to a bony area, which has a hole in the middle. And so when you stack one vertebrae on top of another, it forms like a tunnel. And in that tunnel is where your spinal cord moves down. So it's sort of like here, and the spinal cord will move down this tunnel so that the bones can pretty much protect the spinal cord. And the bones will pretty much bear most of the weight of your actions or whatever it is, your activity, while protecting the spinal cord at the same time. So here's a picture of it where you have got the spinal cord just traveling down, being protected by the bony bits around it. Okay, now in between each, this is what we call a vertebrae. In between each vertebrae, you have what you call the disc. Now the disc is not a bone. The disc is actually like a cushion, like the shock absorbers in your car. It has an outer area which is hard, which is more fibrous, which is like a ligament, which helps to protect the inner area, which is what we call the nucleus. The inner area really consists of water. It is it's water filled, it's like a jelly structure, and this is the main shock absorber. And it's really the water content that helps the disc to act like a shock absorber. Okay, one more bit about the spine that you need to know about is what we call the facets. Now, the facets are joints. Just like your elbow is a joint and your knee is a joint, your facet is pretty much the same type of the joint, of a joint. And the facet joins the vertebrae above to the vertebrae below. So this is joined by, these are the facets to join L2 with L1, and these facets join L2 to L3. Now, the thing about facets is, because it's a joint, it means your spine can move. So it means you can bend to this side, you can bend to that side, you can twist. So because if you didn't have those little joints in between each segment, you would have a really stiff, straight spine. You wouldn't be able to turn to your friend, you would have to turn to your friend. Yeah, your whole body would have to turn because you wouldn't have that flexibility. So joints give you that flexibility. But of course, the more movement there is, the more wear and tear there also is. Okay, so now you have got, that was the bone. Now you've actually got the spine. And the spine, or the spinal cord. And the spinal cord is really, it really just consists of millions of nerve fibers which run through the spinal canal. It starts at the base of the brain and it goes right down to about the L1, L2 area. And that's where the cord ends. After that, it's just spinal nerves, the nerves that go down. So from the cord on each side, you have got spinal nerves that come out. The nerves, and they come out in a pair. And the nerves that come out in the cervical area will send signals to your arms. The nerves that come out in the thoracic area will send signals to your chest and maybe the upper abdomen. The nerves in the lumbar area will send signals to your legs, and it will send signals to your bladder and your bowel as well. The nerves below that go down to your bladder and bowel as well. So basically, when signals go from the nerves to these muscles, they get to move. And so that's why when you have an injury to a nerve, sometimes what happens is you find that you have some weakness in your muscles because the signals from the brain cannot be transmitted well through the nerve. The other thing that the nerves do is that if you feel pain in your hands or your legs, if there's something that's causing pain, it sends a signal through the spinal cord back up to the brain to tell your brain, hey, my fingers hurt. And so that you can react to that. But when there's an injury to the nerve, the signals don't go up as well. And so people start complaining, oh, I've got numbness in my fingers, or I've got numbness in my feet, or I've got numbness in my legs. That could also be a sign that, the nerves are affected. Now, the other thing that supports the spine, which is very important, are what we call paraspinal muscles. These are the muscles around the spine or that attach to the spine. These would be like the trapezius on your back, and you've got muscles around your back as well that all attach to the spine. And what the muscles do is that they support the spine. It's another form of, if you're, instead of the spine, the column taking 100% of all the shock and the weight, the muscles might be able to take 50%, and the spine takes 50%. So again, they're sharing the load. Sometimes, and a lot of the time when you have back pain, it's actually from the muscles, which could be that you pull the muscle or you strain the muscle, or it could also be that actually you have a problem in the spine, but what the muscle has now done is it's gone into a spasm. It's just gotten really tight, so that you can't move that area very much anymore. It's sort of like protecting that area and saying, hey, don't move this area so much. We need to give it time to heal. So sometimes when you've got a problem with your spine, you actually end up with pain coming from the muscles. Okay, finally, for the anatomy of the spine, we have got ligaments. So ligaments are basically like strong rubber bands. And what it does is it holds the bones together. Because while we do want some movement, we don't want excessive movement. If you move too much, what's going to happen is you're going to injure the spinal cord and the nerves inside. So the ligaments make sure that we don't move our spine excessively. It helps to control the movements. Yeah. So that pretty much is what makes up the spine. You have got the bones, you have got the disc, the intervertebral disc, you have got your paraspinal, you've got the facet joints as well, which are an important area because they are frequent area that age and cause pain. You've also got the ligaments, and you've got the muscles that support the spine. Yeah. Now, the function of the spine. The spine does many things. One of the most important thing is, because of our spine, we can stand up. We can stand up, we can walk, we can basically maintain an upright position because of the way our spine works and the muscles that are attached to it. It also, as we talked about, protects the spinal cord, and the disc acts as a shock absorber. It also gives you mobility. And the other thing that happens is, from the spine, you get your thoracic cage. So all your ribs basically come from the spinal column as well. Okay, so what about this aging thing? For those of you who have joined, who are maybe in your 40s, and you think, oh, okay, I will listen to this talk and put in prevention before my spine starts aging. I'm sorry, I have bad news for you, because our spine starts aging around the age of 25. They did a study on a group of people in their 20s who had no back pain, no problems, and they did MRI scans for them. And they found that 30% of these people in their 20s already had degenerative changes seen on their MRI scan. And by the time you get to 50, if you scan a group of 50-year-olds, about 97% of them had degenerative changes in their spine. So yes, I'm guessing most of us here have some degeneration that's already started in our spine, even if we do not have symptoms of pain or stiffness. But we're not here to prevent aging from happening, because we can't. And we can't prevent degeneration from happening completely, just in the same way you can't prevent the shock absorbers of your car or the brake pad linings of your car from, not having wear and tear. But what we can do is to try and put into place practices that will help reduce the rate of degeneration and basically keep your spine structure as strong as possible. So if you can see in this group, and generally you can look at the level of your ear to your shoulder. So when you're young and you've got a nice straight posture, your ear actually, if you look in the mirror, your ear actually lands just above the shoulders. And then as we age, we tend to lean forward, and she's got a nice S curve still. Now you can see the curve is changing a little bit. It's increasing here. And so the neck goes forward, and over time, you get almost a C curve rather than an S curve. Yeah. And this, a lot of this has to do with the bony structure that we talked about, the muscle strength that we talked about as well. Okay. So when we talk about our spine aging, there are actually two processes that are happening, and these processes are happening separately, but at the same time. So they're working in, they're happening in parallel, but they're two different processes. One is a process to the bone, which is the bony part, especially what we call the vertebral body here. We're basically losing bone mineral density, which basically means our spine is becoming osteoporotic. And the problem with the osteoporotic spine is that the risk of fractures, especially to this part, to the body, becomes much higher. And you may have seen sometimes people very bent over or very hunched over because of multiple osteoporotic factors, which then causes the spinal column to collapse. The second thing is the development of degenerative changes. Now, the degenerative changes happens usually first in the disc, that what we call that disc in between the bones that would have that nice water content. So degeneration, this is one of the early places where degeneration happens. Basically what happens, this nice, moist, full of water disc starts to dry out. It starts to thin because of all the wear and tear on it. And as it degenerates, what happens is the vertebrae above can start rubbing against the bone above, can start rubbing against the bone below. Then your body says, hey, why are we rubbing against each other? We need to get a form of protection. So it tries to protect itself by forming more bone. And then you have like what we call bony spurs, which can then press on the nerves because they're growing where they're not supposed to be growing. And then you can have nerve pain, which is another form of pain as well. Yeah. And so that's why if you've ever done an X-ray of your spine, you may already start seeing the doctor may have sort of pointed out all of these bony changes to you. The other one, of course, is facet joint degeneration. We'll talk a little bit about that in a minute. The ligaments also undergo degeneration. Just like rubber bands, when you keep pulling them too much, after a while they lose their elasticity, they get a little bit loose. So in the same way, the ligaments are loose, so they don't support the spine structure as much. And of course, as you get older, especially if you're not exercising, more sedentary lifestyle, you lose muscle strength as well. And remember, the muscles are important to support the spine. Okay. But besides aging, there are other factors that contribute to spinal degeneration. Two 40-year-olds may have different degrees of degeneration because there are other factors that contributed to it. One, of course, is your activity level. So if you are one of those people who love running, dancing, you know, you maybe did some wrestling or you played a lot of tennis, those are high impact sports as well. You know, there's a lot of movement, and so there is a lot of impact on the spine. There's a lot of twisting and turning as well. So if you were someone who had this high activity level, or you worked in a job where you had to carry heavy loads frequently, so you can bet there's more wear and tear and degeneration on your spine. If you've had a previous injury, which could have been a motor vehicle accident, you got involved in a car or a bike accident, or you've had a fall, maybe landed on your buttocks, that affects the spine quite significantly as well. If you had a really bad golf swing, missed it altogether, you could easily hurt your back. And those injuries will also predispose you or increase your risk and rate of degeneration. Remember what we said, if one part of the spine has an injury, it starts to affect the other areas of the spine as well. Weight, yeah, we can never really run away from this, can we? Almost for all diseases. So the thing is, when you have an excess weight, does an extra 5 pounds, a little bit of extra weight doesn't really make a difference. But if you have got a significant amount of extra weight, what happens is that there is more weight on the spine, especially the part over the abdomen, the lumbar spine. Also, the extra weight affects the curve of the spine. And we talked about how the curve was important, the S-shaped curve was important. So the extra weight affects this curve, so it doesn't handle stress as well as it should. Also, people who are overweight tend to have increased inflammation, and degeneration or arthritis of the spine as well is also a form of joint inflammation. Smoking, I'm hoping there are no smokers that have tuned in, but we do know that smoking reduces blood supply and it increases the risk of disc degeneration as well. Some articles suggest that it dries out, your nucleus is supposed to be full of water. So the nicotine in your cigarettes basically reduce the blood supply going there. It dries out the nucleus faster. So the degeneration happens much faster if you smoke. So if you do, today's a good day to stop. Okay. Yeah, so this is what we were talking about earlier. We have got, this is a normal disc, yeah, a nice full, full of water normal disc. This is a disc that's starting to degenerate. You can see that it's thinned out already. Sometimes you have a bulging disc. So a bulging disc is when what happens is that nucleus inside starts to push out. It means that the ligaments around it that's supposed to hold it maybe has cracked or has a tear, isn't able to do that anymore. So the nucleus inside starts to push out, and it can eventually become a herniated disc where it sort of pops out a little bit. And the problem with the popping out is what runs over here will be your spinal cord and all the nerves, and so it's going to hit that. And then, of course, you've just got what we will frequently see, which is a thinning disc. The disc becomes thin, so the two bones start rubbing against each other. The other thing is the disc takes a lot of the shock and the stress. So now if this disc is aging, degenerated, or it's thin, it can't take as much stress as it used to. But you're still giving it stress, right? You're still walking, you're still moving. So who's going to take the extra stress? The extra stress has to be taken by the surrounding structures. And a lot of the times it's by the bone, by the bones around the disc. One of those structures would be the facet joints, which is the joints that we talked about that gives you mobility. And so what happens is this would be a normal facet joint. Over time, now this facet joint has to take more of the stress as well, the extra burden, and what happens is it develops inflammation. There's wear and tear, just like your knee joint. You know, when you get arthritis of the knee, the same thing is happening within these little facet joints, and that can be a significant source of pain. As we talked about earlier, muscle or ligament strain. So if you're not strong, if you are a couch potato, you know, we don't get out and do our strengthening exercises frequently enough, what's going to happen is the muscles are going to get weaker. As the muscles get weaker, it means that it can't help the aging spine as much. And the spine has to take more weight, more wear and tear, more stress. And that means the aging process or the degenerative process becomes quicker. Okay, so the last one was the osteoporotic fracture, and that was more to do with osteoporosis. So this is when you've got nice vertebral body, it lines up nicely in a straight line. But when you have osteoporosis, these vertebral bodies fracture very easily, even without trauma, without a fall, without, you know, an accident or anything. It can just fracture. And it just collapses over time, and that sort of gives you a very hunched over position. So osteoporosis is something that needs to be looked into as well for a healthy spine. Okay, many of you have probably heard of this thing called sciatic nerve impingement, or some people call it sciatica or a pinched nerve. This is what happens when, remember, your disc sort of moves out, herniates, and it presses on the nerves, these nerves that are coming out on either side of the spinal cord, and it presses on those nerves. Now, those nerves may be the nerve that goes down your leg. And so what happens is you start feeling pain in your buttocks, you start feeling pain maybe in your calf, or sort of pain running down your leg. It could be like a shooting pain or an electric current kind of sensation, but usually the source then will be actually in the lower back, in your spine. Okay, so sort of managing it. Now, there are two groups of people that we would look at. One is someone who has some degeneration, as we most probably all do here today, but you don't have pain, you don't have problems, you can still function normally. So here we're really looking at prevention. The other group would be you already have pain. So if you already have pain, then the best thing, of course, would be to look at to try and find out where the cause of your pain is coming from. Is it muscular? Is it from, you know, the disc? Is it from a nerve? And of course, to rule out anything sinister. You know, you don't want to be sitting on something that could be tuberculosis of the spine, or worse still, you know, a cancer of the spine. You just don't want to sit on it. So you want to, that's why you do want to consult with a doctor first, just to make sure that we can rule out what we call the red flags, anything that is sinister. And if we've ruled out anything that's sinister, then we would also tell you that the first thing you need to do is to get onto a regular exercise regime. And so they found that moderate physical activity, not high intensity physical activity, but moderate physical activity makes a big difference to chronic back pain. So things like water exercises, even walking in water, if you've got like a shallow pool that you've got access to, walking in water is great for back pain because the buoyancy of the water helps to support your weight. So it's actually much less painful walking in water. Light resistance and light body weight training has also been quite effective. Or even if you can't get all of that, simply just walking regularly can be beneficial. Now, when you talk about an exercise regime, there has to be a few components, mainly stretching and, of course, strengthening. So when you stretch, you actually are moving the joints. If any of you have arthritis of the knee. Usual complaint is, oh, if I'm sitting down for a long time and then I get up and I start walking, my knees are a bit stiff. But once I walk a little bit longer, it's much better. It feels much better because motion is lotion. As you start moving, the joints lubricate itself. And that's why movement is good for the spine as well. We don't want to overdo it, but we don't want to sit back and not move or lie in bed for too long. That is going to give you a very stiff back. Yeah. So you want to learn a program where you do stretching for your back muscles, movement exercises for the back, and of course you want to strengthen your core. The picture of those muscles that I showed you earlier, we want to keep those muscles strong so that they can continue to help the spine do its job. Okay, so a strong core is very important, and we want to, you should learn some exercises for it. Things like yoga and Pilates, especially nothing too intensive. When I started out, I would Google Pilates for the elderly. It was easier to do, quite safe, and you can start with something like that, or really just for beginners, and you can slowly build up from there, because trying to do too much too soon can give you more injuries. As we talked about, the muscle strengthening will help to reduce the wear and tear. And it's basically like when your muscles are strong, it's like just giving your car new shock absorbers. You're getting all these bumps before you gave it new shock absorbers. It doesn't take away the road bumps. Those speed bumps on the road are still going to be there and you are going to hit them. But with better shock absorbers, you can handle the speed bumps better. So that's what we're really trying to do with an exercise program, to give you new shock absorbers, which are stronger muscles. We can't change the disc that has degenerated, but you can improve your muscle strength. Okay, so here are some exercises. Now, I'm not going to teach you exercises today because well, yeah, that's usually the physiotherapist's job, but I'm sure you just some exercises that are useful when you've got back pain or you want to prevent back pain. The first one, these would be like hamstring stretches. This is what they call the cat and cow, which you would use to move the spine, and you can actually move each vertebrae of the spine nicely. So these are good stretches and range of movement exercises. This is lying on your stomach and doing a push-up, and this really stretches your back muscles. This is what they call the bird dog pose, and it actually helps strengthen your core. So these are some easy muscle or easy stretches and strengthening exercises that you can do that will not put too much strain on your spine, but will help you stretch it and strengthen it as well. So these are the type of exercises your therapist or your instructor will be working with you to do. Okay, so besides and when we talk about prevention, we're really talking about the exercise is lifestyle management. And even though for some, especially if you already have pain, it may be a good idea to do a few sessions with a physiotherapist first, because the physiotherapist will help you understand your limits. But I always tell my patients, you're going to go and see a physiotherapist now. Maybe you might come in once a week or twice a week at most, but you need to have a home program. Because if you are coming in every week, but you are going home and doing nothing, then you are just wasting your time and your money, and you're wasting the therapist's time too. There must be a home program that you do at least once a day. I prefer twice a day. So it's called self-management, because if you don't do it, nothing is going to change, and it won't be the physiotherapist's fault. Yeah. So that self-management is very important. The other things that we need to look about is what we call ergonomic adjustments. Our sleeping posture. Our spine should be in a straight position. Pillow too high, not good. Pillow too low, not good. So your pillow should give your neck a nice relaxed posture. If you're a back sleeper, it's a good idea to put a pillow underneath your knees to help maintain the curve of your spine. If you're a side sleeper, it's good to put a pillow between your knees to help maintain a straight spine as well. Things like sitting. Sitting on a chair, we all tend to slouch forward, especially for those of us who are on the computer. But remember to sit back, sit up straight, make sure your chair has got a lumbar support. Make sure your ears, your shoulders, and your elbows are in a straight line. Yeah. So ears, shoulders, elbows, and hips, right down to your hips, should be in a straight line. That's your basic neutral position. Okay. And this should be the position that you're using most of the time. Now, some companies as well have standing desks, which I think is a good idea, because sitting too long is not good for your spine. Standing for too long is not good for your back either. So if you've got the opportunity where you can sit and do work for half an hour and then stand up and do work for maybe another 20 minutes, that's a very good idea, very good for the spine and the lower back as well. So try not to have awkward body positions, especially a lot of us on our phones, we are like that. How many of you do that? Huh? Who's hands up for those who are guilty? That's really bad for your neck. When your neck is straight, our heads are actually quite heavy, believe it or not. Our heads, we've all got heavy heads. And then when your neck is straight and your spine supports it well, the minute you bend forward, for every 5 degrees you bend, the spine has to take so much weight, because it's like when you pick up an object close to you versus you trying to pick up an object from far away, you put so much more stress on your back. So when you're on the phone, up, okay, which means don't walk and be on the phone as well. Okay, so try and maintain that upright position. Again, proper lifting technique. Don't bend over. Bend at the knees, not at the back. Make sure the object is close to you before you lift it. Don't stretch out and try and pick up an object. So now, if you have pain, what would you do? Most papers would suggest cold first. Get an ice pack, apply it 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off. You can do that for most of the first day, just to reduce the inflammation and the muscle spasms. After a few days, you can consider moving to a hot pack, something that's warm, or taking a warm bath, or applying one of those hot gels, or those warm gels that on your back muscles, which will help to relax the back muscles, improve the blood flow. Just remember, if you're using a heating pad, not too long, because you don't want the risk of getting burns, especially as we get older, our skin gets more fragile. So usually I would suggest, if you've got a hot pack, wrap it in something first. Wrap it in a thin towel or something first. When you have got muscle spasms, stretch. After you apply heat, do a bit of stretching so that you can help reduce the muscle spasms, because muscle spasms is a source of pain. Okay, smoking. Remember we talked about smoking just now? The bad news is that smoking increases degeneration. But the good news for you smokers out there is that they did a study, and for people with back pain who were smokers, for the group that stopped smoking when they had back pain, they had greater improvement in their back pain. For those who stopped smoking, they had greater improvement in their back pain compared to those who didn't stop smoking. So like I said again, if you haven't stopped smoking, today is a good day to start. Healthy diet goes without saying. Healthy diet and losing weight goes without saying. I always say reduce the sugar in your diet. Sugar causes inflammation. Sugar is poison. Sugar is bad. Okay, so really try and cut down this sugar in your diet. So healthy and cutting down the sugar will help with losing weight much easier as well. Okay, sometimes your doctor will prescribe medication. Now, Asians, we're like, no, I am Superman, I'm Superwoman, I do not want to take medication. But the problem is this, there is something called a pain cycle. So and pain has two components. There is the physical component, and that is the, ow, it's painful, I feel that pain. But there is also a psychological component to pain that we cannot ignore. If you have pain today, you've got knee pain and you go to work, and we always use a pain scale. Is your pain from 0 to 10? 0 means no pain, 10 means the pain is so bad, you want to die from the pain. It's just the worst pain you can imagine. So we will ask people, what is your pain from 0 to 10? So saying your pain, you feel it's about a 4, okay? Then you go to work today and your boss says, wow, good job. I am giving you 3 months bonus and I am promoting you. Trust me, your pain from a 4, that day will feel like a 2, okay? Because when you feel good, also your body produces endorphins, which actually helps to suppress that feeling of pain. But if your pain is a 4 and you go to work and your boss says, I'm sorry, I've got to let you go today, company is downsizing, your pain from a 4 will feel like an 8, because your emotions affect your pain levels as well. So the thing about pain is that if you have pain, you will stop doing things. It's painful to walk, so I don't walk. Say you've knee pain. It's painful to walk, so I don't walk. You don't walk, your muscles get weaker. Your muscles get weaker, it means they cannot support your knee better. Because it's supporting your knee less, you get more pain. Then there's the other component, of course, you get more pain, you start feeling stressed, you start feeling anxious, you start feeling angry. Sometimes pain can, just like hunger can make us hangry, pain can make us pangry. Okay, so pain can make us angry as well, yes. So you're in a bad mood. Eventually, after a while, chronically, it can lead to depression. And the more depressed or upset you feel, the worse your pain feels. So sometimes you just need to break that cycle. And they find that if you take painkillers, say on a pulse dosing, like 2 times a day for a week, even if you don't have pain, it gives you a better overall effect than sort of saying, I'm going to take it only when I need, only when I really cannot tahan. So sometimes the best way to break the pain cycle is with medication. And for the back, we usually suggest anti-inflammatory medication. So that it gives you time to be able to feel better, be more motivated, and do your exercises. Otherwise, if it's too painful, you won't even be doing your exercises because it's too painful. So that's something to keep in mind. If medication doesn't work, sometimes there are things like steroid joint injections. And this is obviously after an MRI and with a consultation with a doctor. Sometimes injecting steroids into the facet joints helps to reduce the inflammation quickly. I've had patients who've had very bad pain. I don't do the facet joint injections. I usually send them to an orthopedic who does that. And, 1 year later, still no pain. So it can give you very good relief because it gives you that break as well to get into a rehabilitation program for your back pain. If steroids doesn't work, or if they work but the pain keeps coming back too frequently, then they have such things as radio frequency ablation, where actually what they're doing is they're burning up the small nerves around that joint capsule, around that facet joints, that is becoming a source of pain for you. So that is an option. Some hospitals do that as well. Okay, so just to recap a little bit, when you do, for most of these patients, conservative treatment is sufficient. Sometimes you will need to go for patients where this doesn't work, then you may need to consider surgery. If you have a disc that has herniated and it's pressing on a nerve, if you are able to, we would suggest an exercise program. But after about 3 months, if you're not getting that improvement, then you need to consider maybe doing something a little bit more invasive. A lot of the surgery is actually very fast. It's almost like a day thing. They do it very quickly and very easily now, but sometimes a small minority of patients will need to consider that. Compression fractures, as we get older and we are more prone to compression fractures, sometimes injecting something that's called like a cement into the fracture area can help stabilize it and relieve pain very quickly, very easily. Okay, I'm keeping to my 40 minutes, just about. So basically, in conclusion, we cannot turn back the clock. Degeneration that has happened, but what you can do is you can strengthen the muscles around your spine, and you can practice good posture, a healthy lifestyle. to prevent or to reduce the risk of further degeneration. Yeah. And this will help you reduce your pain and improve your quality of life and function. And remember that everybody has some amount of degeneration of the spine. And all of us at some point in our lives will get some back discomfort or back pain. It is a fact of life, but don't let it stop you. Okay, you should be able to get into a program that helps you cope with it better. Okay, and with that, I am going to end. Thank you very much for being a very attentive audience.
Thank you so much, Dr. Kavitha. I wonder how many people are, trying to kind of position themselves and measuring them from the ear to the shoulder, and see what kind of line there is, talking to each other.
Well, I did it when I was putting my slides together. I said, "Oh, let me try that." I went and stood in the mirror and took a picture of myself.
And I think many people, over the next few days, if they see people walking in the swimming pool, they're going to say, "Did you watch that webinar? I mean, is that why you're doing this? Did you listen to Dr. Kavitha?" And as for the smokers, well, I think they're all kind of turning to the wall right now and saying, I wish you hadn't said that. But hey, thank you for flying the flag for not smoking. It's been a very, very interesting session. I think it's been most enlightening. And I kind of think that, if my biology teacher had been as good as presenting this body part stuff as you had, maybe I would have thought seriously about studying medicine. But anyway, as a mechanical engineer, I was really thrilled to see all the wonderful engineering that there is in the spine. So thank you for reintroducing me to the great engineering of our body.
Yes.
Yeah. So let me just see whether we have any questions posted yet. We do have a few. Okay, some of them are kind of like, okay, here we go. Oh, I have some lovely assistants here. The first question, is it advisable for the elderly to wear a back corset? Okay,
good question. In fact, my mother-in-law is 93. She wears a corset when she wants to cook, or she wants to, when she knows that she's going to be standing for a while, because she gets back pain as well. Now, I think if you look at the evidence on using a lumbar corset, it's not one way or another. It seems to help some people. It doesn't seem to help others. There is always the fear that, if I use a corset, then my muscles are not going to be working and my muscles are going to get weaker. Now, I think that's not going to be the case, because you will be doing your exercises, so that will keep your muscles strong. But we also need to accept that as we get older, as we age, we can't change degeneration that has already happened. And so sometimes we need a little bit of support. So if you're going to be doing something today that maybe is going to aggravate your back pain, if you want to say go to the mall and you're going to be walking, this is going to get a bit painful, and for you a corset does help, I would definitely put on that corset, because from a rehabilitation perspective, we want to have quality of life. So sitting at home and not going out is not the answer. If a corset helps you do a bit more, and be happier doing a bit more because it supports you and reduces your pain and gives you that little bit of support, by all means use it. But if you feel that the corset makes no difference to you, then I would still say stick to good posture, doing your stretching and strengthening exercises. But I have patients who say, every day must do stretching and strengthening. No pill, I can just put in the pill and I'm done with it. I wish there was, but no.
Thank you for a good answer. Well, our next question, do you have any tips for the dentists? Many of us can't seem to get our posture just right when we are treating patients. Wow, thank you.
Yeah. I sympathize with the dentists. When they really have, I don't know, I sympathize with them. Yes. You need to fix that dental chair of yours. I don't know, you need to get, I guess if you could get the dental chair higher, because there does seem to be a lot of bending over. I know dentists sit on a chair now and that helps, but you're still leaning over the patient. And so you are stretching your back. And sometimes you don't even need to lift up anything heavy. I have just reached over to pick up my toothbrush once, and the next thing I knew, I couldn't stand for about 4 hours because I had such bad back pain. And I was on a holiday in Vienna with my husband, so we had to cancel everything for the day. All I was doing was actually I was leaning. Instead of walking right up to the table, I leaned over to put my toothbrush in the bag. So, I do think somehow the dentists need to change their position so that they can get right up to the patient. I think the height has to be good with the dental chairs. You need to complain to the Dental Association to get better chairs.
Wow, that's a great question and a great response. Wow,
But
the ergonomics.
I would say, as a dentist, you better keep your back strong.
Yes, I think a lot of the dentists will be practicing some of these stretches from now on. The third question, anti-inflammatory causes stomach upsets for me. Is there any alternative?
Okay, so a couple of things. I mean, Panadol is probably the safest, though it doesn't have so much of an anti-inflammatory effect. It does have a little bit, and you could try that first. If that works for you, that's great. They generally suggest the opioid-based ones like tramadol and all that not really be used so much in spinal degeneration. The go-to is still the non-steroidal anti-inflammatories. So if it's really bad, what you could try is perhaps taking it together with with a medication that helps to line the stomach and prevent the stomach upset. So I'm not sure if you've tried taking it together with something like what we call a proton pump inhibitor, like Controlock or Nexium, so that it helps to prevent the stomach upsets. The other thing I would say is take it on a full stomach. So if I take an anti-inflammatory on an empty stomach, it kills me too. But if I've had a good lunch and I take it, or a good breakfast and I take it, then I'm generally okay.
Thank you. Great answer. Oh, I love this one. What's the difference between seeing a chiropractor versus orthopedic surgeon and physiotherapists? Okay. Ooh, I want to hear your answer on this one.
Okay, I'm going to go with the orthopedic surgeon and the physiotherapist first. So as you know, the orthopedic surgeon is a doctor, a surgeon, and their focus would be they would be able to manage back pain, not a problem. It's very much their bread and butter. But in the early stages, they would probably say what I've pretty much told you. We want to get into a program to strengthen your muscles, to stretch, to manage the back pain, and let's see how you're doing. And if you're doing well, good and well, we continue with that. And if you're not doing well, and sometimes, based on the MRI, they will know this is not, physiotherapy is not going to work here. You're very unstable spine. We probably need to go in early. And they would do the surgical management or surgical correction for that. Whereas the physiotherapists are not doctors, but what they will do is they are experts in the exercises, prescribing you with the exercises and with the home program, helping you to make sure that you're doing it correctly. And as you get better and stronger, sort of upgrading the program for you. So they would probably start with pain management. There are methods to manage pain without medication, besides medication, which would be electrical stimulation also for pain, ultrasound therapy, the heat pack, the cold pack, they will be doing that too. So the physiotherapist will be helping you with the exercises, with that part of the program. Now the chiropractor, as I tell my patients, when I was in medical school, they didn't teach us about chiropractors. But my limited understanding is chiropractors sort of manipulate the spine. They sort of say, okay, your spine's not in its S shape. Let's see what we can do to try and get it in its better shape. I don't understand how it works. I'm sorry, because I have had no prior knowledge of it. I'm not saying it doesn't work. I just say that I don't understand enough to sort of prescribe it anyway.
All right, thank you. Very honest response. Thank you for that. Can collagen supplements help in replacing the fluid content in the discs? Before you answer that question, do you have any stocks in any supplement manufacturing companies? Okay, then you can answer that question.
I wish it did, because then we'd all just take collagen supplements and that would sort everything out. So I think if you look at big studies, it doesn't really make a difference. Unfortunately, of course, and the thing that frustrates me with marketing sometimes, there are no studies around it, but the marketing says it works, and yeah, but generally, I think if you look at big studies, the reason there are so many supplements is because nothing really works. I always say if one disease has got about 20 medications stated for it, it's usually because nothing really works that well. Nothing really cures it, so we're all trying little bits of this and that. So I'm going to probably say no.
Thank you. Do we have any more questions? Oh, yes. Doctor, does the nerves in one side of the upper part of the spine, nerves at the neck, affects one side of body, sight, hearing, dizziness? Any solutions, recommendations?
Okay, so it can, if you're talking about the cervical spine, as the nerves come out, there is something that we call cervicogenic dizziness, and which basically means the problem lies in the cervical spine. It could be impingements of the nerve, it could be even the blood vessels in this area, but you would probably need to get a doctor to assess you first, and to sort of make sure that there's nothing sinister that's going on. And then if there isn't, then usually we would do something like there is medication that could help with the dizziness. But if you sort of say that you've got problems with your hearing as well, maybe sometimes you get a sound like a high-pitched sound in your ears, then you may need to actually do a scan first to make sure that there's nothing sinister there. And if there isn't, then you could do like what we call a vestibular rehabilitation program. And usually you may need some medication for a short period of time to help you get over the dizziness. But something like this you would probably need to see a doctor to get them to assess it.
Thank you. Clear answer. Thank you. How long is the duration of how long duration of exercise is enough per day or per week? I'd like to know the answer to this.
Okay, so I usually tell my patients, you exercise 6 days a week, you get 1 day off, knowing that if I say 6 days, they'll probably only do 5 days. So minimum is 5 days. And if you can, you should do so. A lot of people, what we do is, myself included, because I have back pain issues, is in the morning, I do just a 10-minute stretching routine when I sort of get out of bed. And then in the evening, I may do about 15 minutes of maybe like Pilates or something that has more strengthening in it. And it really does help keep that back pain away.
Right, thank you. I wonder, okay. What's your view about, I was wondering whether we get this question. What's your view about acupuncture for back issues?
Okay. I am actually a fan of acupuncture in the sense that, when you have got back pain, as we talked about earlier, you have got muscle spasms. Your muscles around especially the lower back become tight. And so there is something called dry needling, where you stick in these needles, and they're very much like acupuncture needles, into these trigger points, into the spasms of where your muscles have created like a little ball because of the spasm. And that actually helps to release the spasm very quickly. So is acupuncture going to cure the degeneration? No, nothing is. But it can help relax your muscles. So you can get some periods of reduced pain, and during that, it's a bit like heat therapy as well. Your muscles relax, and when your muscles relax, you want to start stretching it, because you don't want it to just get back into that spasm again so quickly. So in my view, it's not a cure, but a lot of patients, when they go for an acupuncture session, they feel much better after that. Most of them will say after a few hours, the pain does come back, or the next day it's back. But if it helps you for a few hours, do your acupuncture, follow it up with your stretching as well. If you feel it helps you, by all means.
All right, thank you. I'm going to ask a question of my own now. There's something that I've been thinking about. So saunas, so there are some countries, some of these Nordic countries, for example, saunas are a real big deal. Everybody has a sauna. Is there any evidence that the use of saunas, has any impact on the rate of degeneration or in the management of pain?
Okay, so sauna would be heat therapy. So heat does relax muscles. Heat does improve blood flow. So that I would say would be helpful. A short period of heat, a short period of sauna, followed by stretching. In terms of increasing the rate of degeneration, I am, to be honest, not aware of that. Could be that we don't have enough saunas here, so it's not something that, I've really looked into. I will look into that, but it's not something that I'm aware of.
All right, thank you. This is a great question. How dangerous is it to seek treatment from the Chinese practitioners? I don't know what Tit Da is, but Tit Da doctors. I guess it's Chinese traditional medicine.
Well, the Ministry of Health has an entire section on alternative medicine. So they have, Chinese practitioners. They have. I remember when I worked in Sungai Buloh Hospital, they had Varman therapy, which was from India, and it was actually they actually had a doctor who did it. So I would say, yeah, but same as chiropractors, I have no sort of immediate knowledge or no, I don't have good knowledge of this, but I would say if you do decide to try alternative medicine, make sure it's someone reliable. Sometimes when you're in so much pain, you listen to anything anyone tells you. And that I feel is more dangerous than anything else. So make sure it's someone who is licensed, because now with the Ministry of Health having a section on alternative medicine, you have licensed practitioners. So go to a licensed practitioner, even if they tell you, I'm sorry, I can't help you with this, I can't do this for you. Trust them. Don't go to the next guy who isn't licensed, who says, yeah, no problem, I can sort this out. So go to someone reliable, reputable, and who is licensed.
Great, thank you very much. When gardening or squatting, I feel back pain after 20 to 25 minutes. Is it normal?
I feel back pain after 10 to 15 minutes. You're fine. I would say it is, if you are going to feel back pain after 20, 25 minutes, time yourself. At 15 minutes, get up, stretch, walk around, then get down again. So it's about pacing yourself. When someone has back pain as well, we say that if you know that sitting down for 30 minutes at your desk is going to aggravate your pain, set your alarm. 25 minutes, get up, walk around, do some stretching, come back and sit. So usually chances are when you get up, you've got that stiffness, that pain, that ache, those are all signs of arthritis and degeneration of the back. So remember, getting up and moving around, motion is lotion, will help to lubricate those joints as well. So that will help you. And don't forget to keep those muscles strong.
Right. Motion is lotion. Everybody's going to be singing that. Any recommended food or supplements to slow down osteoporosis and build up muscles? I wish.
Well, for recommended food or supplements, I'm probably going to say no. You need to make sure you've got enough vitamin D, because that calcium and vitamin D. So it is interesting how a lot of Asians are actually deficient in vitamin D. But if you have your vitamin D levels are normal, there's no point taking the supplements. Honestly, it's not going to make much of a difference. But you can always just get your vitamin D levels checked. And if you are on the deficient side, supplements would be a good idea. Because even though there's so much sun, we all don't want to go in the sun. So, interestingly, many Asians are deficient in vitamin D.
Really? That's interesting. I didn't know that.
Yeah. So, So sometimes previously they would, especially postmenopausal, they would give you medication for your spine as well to prevent osteoporosis. I am not sure how much I don't see it so much anymore. It was taken quite freely before, but I think they also found that even though it built up bone density, it made the spine really stiff. So as people got older and if you had a fall, the risk of fracture, because your spine was stiff, and it kind of lost its flexibility. So the risk of fractures were higher. So now I think they will only give it to you if you've done a bone mineral density scan and it's proven that yes, you are osteoporotic. Only then would they treat you with it. But in terms of supplements that you buy outside, no, I'm going to say no.
All right, thank you. May I know what will happen after slip disc recovery? New growth of disc, empty space between vertebrates forever? Also, can slip disc happen again at the same place? I'm sure you get these questions all the time.
Well, I say the orthopedic surgeon gets this more because I would have sent them off to the orthopedic surgeon. But so what happens, it's usually, if you remember the pictures from just now, a part of the disc, most commonly a part of the disc sticks out, and it hits a nerve, and that's what causes the pain. So what they will do is a disectomy or a micro disectomy. They will just try and cut off the part that is sticking out. So yes, you can have, so there's no new disc that's going to grow, unfortunately. And what can happen is later on, as our spine gets older, it's not so, there's more, it's more loose in that sense, it's not held together well. You can also get more of the disc coming out. So I do know people who've had to repeat a micro disectomy and repeat the surgery.
All right. Thank you. Could you recommend some whole body exercises for the spine well-being as walking, Pilates, etc. address limited areas?
I think swimming is quite good exercise because it really does. There's a lot of movement. There's a lot, you've got the water to help you to support your body weight. It really is almost a whole body exercise. It's just that not everyone likes getting in the pool, but it is one of the best whole body exercises there are, without putting too much wear and tear on the spine. And it does do strengthening as well. So you could alternate, like, swimming one day, and you could do light weights, or light resistant exercises the next day. So you could alternate between the two.
Okay, thank you. Yep. What do you think about electric stimulation therapy versus acupuncture? Which ones are more effective? You should ask Bruce Lee this question.
Okay, so the thing is, both can really be used for pain relief. So when it comes to pain relief, I don't think there is one that's superior. Between the two, I don't think one is superior to the other. When it comes to pain relief, I will usually sort of say to patients, what works better for you? So I don't think there's any evidence that says electrical stimulation, or TENS is usually what they use, transcutaneous electrical nerve stimulation, versus acupuncture. I don't think one is more superior to the other. Now, the guys doing acupuncture, they may have a different view from me, but I'm just thinking purely from the perspective of managing pain. I would probably say what works best for you.
All right. We have lots of questions today. Could you recommend any YouTube channels which provide reliable exercises for the back and neck?
I probably would say I don't, because I don't have a channel that I specifically follow. I sort of initially because I kind of know what I wanted to do, I would go to I would go to a few. I would just Google them, and then I sort of got an idea, and I just do my own thing now, based on different things that I've put together. So, but the other thing I would worry about recommending something is that I don't know what the condition of your back and neck is. And this is presuming that everything is okay. And if everything is okay, to be honest, there are lots out there. You could just Google, and I would recommend generally Pilates for the back and the neck. I think Pilates is really good for your core. And you would probably want to start with Pilates for the beginners. But if you already have pain, without seeing you and assessing you, I would be a bit hesitant to recommend something.
So I think I can predict that in the next, soon, or maybe it's already started, I think a lot of people who've been on this webinar are going to start searching for Pilates for the aged, and it's going to be a big search item in the next few minutes, I think. If one could not squat all the way down, does it signify spinal problem? And is there any solution?
Okay, so not squatting down can be one of multiple problems. It could even be the knee. So it could be the hip, it could be the knee, it could be the pelvis. It could be the lower back. But the thing is, why is it that you can't squat all the way? Is it that your muscles are weak? So it's not supporting you as you go down, or it's difficult to come up. So it doesn't necessarily signify a spinal problem, if you ask me.
Okay, gotcha. Okay, I have no idea what MSM means. So masochism, maybe? I'm not sure. Does MSM help with pain management? What is MSM?
Okay, I don't know what MSM is. That person wants to just rewrite the...
Yeah, maybe just rewrite that question so we know what it means. How do bone spurs happen?
Okay, so typically bone spurs are when there is rubbing. So for example, commonly people will talk about bone spurs in your knee because you're losing the gel in the knee, and you lose the cushion over the bones, and so the bones start rubbing against each other. So same thing for the spine. If you remember the picture of the two bony vertebrae, and you've got that disc that's a cushion in between. So as the cushion has wear and tear and the cushion gets thinner and thinner, there's more pressure on bone against bone. And so the bone sort of says, hey, I'm getting more pressure here. I need to protect myself. So it starts forming more bone there, which comes out in the form of a spur. So that's actually how your bony spurs happen.
Right. Thank you. Thank you. Methyl sulfonimethane. No?
Oh, I think it's like LMS, if I'm not mistaken.
Is that a gas?
No. And that's something that you rub on. Is that right? I'm just going to Google this, okay? So I'm actually telling you the right thing. See, doctors Google too.
You're giving away the secrets.
Oh no, it's a supplement.
Alex Tan has just put a comment here that I must read out. Thanks, Dr. K. Listening and seeing you in a jovial mood already helps to alleviate the discomfort. How nice.
That's so kind of him. Okay. So MSM is quite a strong anti-inflammatory, but I'm also seeing it under foods, as in supplements. So I'm going to say that I generally avoid supplements. So it's a popular supplement, but I generally avoid supplements because there's no really good evidence that it works. But I think it sounds like it has got some anti-inflammatory properties in it.
All right. Okay. Well, thank you for that. I think we do need to end now. So we'll just treat this as the last question. What about spondylosis? That's the one. Spondylosis.
Okay. So spondylosis is basically degeneration of the spine. It is a form of spinal degeneration that happens in the vertebral column that we spoke about. Basically, it's a term for spinal osteoarthritis. So it's the same as the wear and tear. So when we see all of those the facet joints, that are being inflamed, even when you see bony spurs, basically when we talk about spondylosis, we just talk about degeneration of the vertebral column. So it is a bit of a broad term.
All right.
But so you would say, if you see spondylosis, it would be the same thing. You will say that, well, you have got aging of your spine, and you just need to put into place what we've talked about, lifestyle changes, lifestyle modification, healthy diet, healthy weight, your stretching, your strengthening, and of course, your back care, how you lift things, all of that, very important.
All right. Well, thank you so much. One of my big takeaways from today is we're all, I think there's one more question that we have to, sometimes my fingers get numb. Is that because of spondylosis? Now I can say the word. Thanks.
It could be one of 20 different things, I'm afraid. It could be, for example, it could be the nerve, carpal tunnel is very common and which can cause numbness. Diabetes is also something that can cause numbness in the fingers. It could be an impingement sort of in the nerve at the neck, but usually that's more one-sided rather than both. And you may sort of have pain going down the arm. So I couldn't say for sure that it is due to degeneration in the spine, because it could be one of many things. But if it is bothering you, especially if you feel that picking up things are difficult, you're dropping things, you should go and get it checked.
All right. Well, thank you so much. I was joking with you on the chat that, you're a rehabilitationist. And I had to practice saying that as well, because it's not an easy thing to say. But thank you so much. I think it's been really, really enlightening. And, I'm a long back sufferer. I've had pain in my back for over 40 years, learned to manage it and so on. And it's been very helpful listening to you. And I think many people will walk away greatly enriched. And I see a lot of positive comments, which unfortunately we don't have time to read. But thank you so much. I just want to, we're 20 minutes over time. So I just wanted to say to all those who are still with us, and it's incredible, we still have 84 people, I think, with us, at least on Zoom, and we had over 100 earlier, and I know more on Facebook. But a recording and an ebook of this talk will be made available at the MNCC website. You can see it there, mymncc.org, but you can also see the live recording just by going to the Facebook page, so it's there already. And we would love to have your feedback, so you can just scan. Now we scan everything, right? Because we're Malaysia people, we're so used to scanning. So you can just scan this code and you can give us some feedback. There is another episode that we will be announcing soon. That's, of course, part of our online rehab health talk series. And episode 6, swallowing issues in elderly. I think that's a very important topic, and that is coming soon. So just wait for the announcements. Like and follow us on our Facebook page. Thanks again. Thank you, Dr. Kavitha.
Thank you so much. I really enjoyed myself.
All right. All the best.
Bye-bye.
Bye.